Good afternoon. I'm Dr. Eric Turing. I want to welcome you to the webinar today. The webinar is sponsored by the American College of Veterinary Preventive Medicine and our partner organizations, the American Association of Food Safety and Public Health Veterinarians, the National Association of Federal Veterinarians, the National Association of State Public Health Veterinarians, and the U.S. Animal Health Association. I am going to turn it over today to Dr. Sierra Gwynn. She is a member and the incoming chair for the ACVPM Continuing Education Committee, and it will be her honor to introduce our guest speaker today.
Hi, everybody. Dr. King certainly has been around the One Health space and veterinary preventive medicine for a very long time. He is a longtime graduate of The Ohio State University for his DVM. He also has a master's in epidemiology and a master's in public health administration. He has been the dean of the College of Food, Agricultural, and Environmental Sciences at Ohio State, which is a very big job. And he's also an advisor to the One Health Global Alliance, where he really provides a lot of his strategic guidance and scientific help for that group to really get involved in One Health. And so he's going to talk to us today about what we can do and veterinarians and in our college to get us moving forward in the One Health space. Thank you for agreeing to speak with us, Dr. King.
Well, Sarah, thank you very much for your kind invitation. And the only thing I might add is I'm also a proud diplomat of the American College of Veterinary Preventive Medicine and have been for some time. And I take great pride in our organization and in working with the colleagues in ACVPM. So today we're going to focus this seminar on One Health, to focus on reflections on challenges that we have and the need for professional transformation, which we're going to spend a lot of time talking about. And I also anticipate this is a part of the future role for potentially ACVPM. Next slide, please. And I'm going to turn my video off and so to let you just focus on the slides rather than me. So as you might know, One Health is really founded in antiquity. So we know that it's been around for some time, certainly goes back to the time of Aristotle and even Louis Pasteur. But we really focused on kind of the reemergence of One Health over the last 50 years and especially over the last 20 years. So if we go back and look at kind of the model reemergence of One Health, we recognize Jim Steele and in terms of his work in public health, veterinary public health and CDC, Dr. Cal Schwabe in One Medicine. By the way, the AVMA recognized ACPM in 1978. So we've all been engaged in preventive medicine for some time. But in 2006, the One Health Task Force was assigned by AVMA, and I had the pleasure of chairing that session. And that report then was launched in 2007 at the AVMA meeting in Washington, D.C. And that meeting really was a convention dedicated to One Health. And at that time, Dr. Roger Marr, who's president of AVMA, and Dr. Ron Davis, who's president of the American Medical Association, professed their collaboration on One Health. And that meeting was actually started then by a keynote speaker of the director of CDC. So that was really kind of the launch of a new beginning, if you will, of One Health and the new importance to the profession. In 2009, there was the One Health office created at CDC. Many more have been established since then. 2010, tripartite coordination and adoption by the World Bank in terms of looking at economics and the impact of One Health. The first One Health Congress was held in Australia 15 years ago. And then if you looked at kind of 2012 till today, there's been a rapid growth and I think a growing acceptance of the concept. So as we take a look at where we've been, where we are, and what's happening today, next please. There's really been some examples of outstanding progress, and we take a lot of pride in our leaders that have been involved in these things and in their work over the last 20 years in particular. And I can point out to several, I think, outstanding examples of progress in One Health. The quadrilateral organizational coordination and support, The National One Health Framework was published to help address zoonoses in the United States. There's a U.S. One Health Coordination Unit, which is about the leadership across the agencies, really critical. There's a President's Advisory Council on combating antimicrobial resistant bacteria. That was 10 years old, and it really centered around One Health as the coordinating concept. One Health has had political support, especially through AMR, from the G7, G20, United Nations, World Bank, and UNICEF. So 20 years ago, they haven't been engaged or probably even knew anything about One Health, but they are today. The One Health high-level expert panel is a coordination between the World Organization of Animal Health, FAO, and WHO, and it's a really important group that's making really exceptional progress for it. Social sciences have come in and are now very much involved in One Health, and we welcome them. They have a lot of insight and value to add. There's a group that is formed that's working on looking at education and the acceptance of One Health in veterinary students, the North American One Health University Network. Really important, the World Health Assembly published its first pandemic agreement. Next, please. And if you look at kind of the research and scientific publications have really expanded and grown. Since 2003, there's been over 12,000 publications just involving One Health. The national antimicrobial resistant plans that every country have in the world really focused on One Health approach. We've learned a lot of lessons from recent epidemics and pandemics, and the acknowledgement then for a One Health framework as we move forward. There are centers, commissions, programs, and teams that have also increased focus on One Health. One Health competencies have been identified, and slowly but surely they're being taught now in veterinary medical colleges. There's a new awareness of the impact of epidemics. Really, they become a national security issue. And now we have the inclusion of One Health and pandemic threats and preparedness and detection and response and resilience, both on a national and global basis. So a lot has been accomplished, but because of where we are, a lot more needs to be done. Next. So back in about 2003, there was a groundbreaking study and a publication by the National Academies of Medicine. It was actually led by a Nobel laureate, Dr. Josh Lederberg, that talked about the convergence model or the perfect microbial storm. And that group talked about coming together of critical factors, whether genetic, biological, physical, environmental, ecological, political, social, and economic, that have created the environment for a microbial storm, where the center of that hurricane was new emerging diseases, whether they're in animals or people or wildlife. And most of these new emerging diseases were actually zoonotic. So it was that critical time in 2003, right before we launched this movement in American Veterinary Medical Association, that things started to change. That these factors had been created in a world that was increasingly enlarged and interrelated and interconnected. So if you look at the factors then that were projected and the importance that were really recreating these new threats, that study then listed a number of these, and these were driving forces and risk factors that created new health threats today and when they were done. Eric, I think you could go all the way down and list the whole list of them right now and just stop at the bottom. You stop right there. So if we would take kind of a subjective look and look at these factors when that report was published in 2002, 2003, we looked at human demographics and behavior, changes in technology and industries, economic development, land use, amazing amount of international travel, trade, commerce, opportunities for microbial adaptation as they had new factors to deal with, the breakdown in public health measures, which we worry about, especially today in terms of funding, climate change, weather, changing ecosystems, poverty, social inequity, war, famine, the lack of political will, especially political to engage in One Health and fund it, and also the intent to do harm. So if we look at these factors, 2 decades ago and look at them a decade ago and where we are today, all of these factors, a new generation, they're more intense, they've multiplied, and they certainly are more consequential over this time. So while we are doing more in progressing One Health, there's a lot more to be done because these critical factors have increased and become more important in our lives and the creation of new threats. Next. So let's take a look at some of these threats and kind of where we are and what's going to be expected of us as we move ahead. First is that, demand for food and our concern about food safety and food security is a key part of One Health. Last year, we raised and slaughtered about 50 to 60 billion livestock and poultry worldwide. 315 million tons of meat were consumed by about, 8.3 billion people on the face of the planet. And there's been a disproportionate increase in the production and the demand for protein in countries that are less developed and kind of medium income countries that we worry about their infrastructures and their ability to deal with pandemics and epidemics in a timely way. We know worldwide our livestock actually probably consume 35% of all of our crops produced, and they are part of 35% of all arable grazing land. So they are a big factor in One Health and in food safety and security. And globally, we add between 1 and 1.5 million people to the face of the earth every week. So this is only accelerating. It's been estimated in the next 40 years that we're going to need more food produced than in the last 500. So think about how that's going to be done, where it's going to be done, the vulnerabilities, the new threats to our food systems. We have this new 21st century mixing bowl. We're going to need 120 billion livestock and poultry by 2050, 10 billion people, products moving all over the world, and our threats are becoming even more intense, hence the need for this One Health approach. Next. So a threat anywhere is a threat everywhere. And we know that, just because we sit in the United States, we're vulnerable to threats worldwide. I can remember very vividly, it's 2002, 2003, where a single virus particle, probably maybe in a mosquito, appeared in New York City and spread throughout the United States very dramatically, and now has really changed the fundamental vector-borne disease pattern and ecosystem impact of that disease. And in 2003, we woke up to West Nile in the United States, monkeypox, and SARS, 3 diseases that have never been in the Western Hemisphere before. So we knew something was changing, and it was these factors. But what we were starting to realize back then were, how do we address these factors in a different way? And that was based on a One Health approach. Next. So the importance and understanding of the environment and our ecosystem factors to health threats. I think over the last decade, we've become enlightened, and there's a stress for greater focus on this critical domain of One Health. It's especially been apparent to us, I think, over the last decade with climate change, the contamination of waterways, changing land use, extraction industries and their impact, degradation of ecosystems, our interface of animals, populations, changing agrosystems that are globally interconnected, and the tragic loss of biodiversity during this time. So the One Health global domain of environmental health has become even more critical, and it's one that we need to pay, I think, more attention to and engage in more environmental scientists. Next. So this is a little bit hard for you to read, but it really talks about the increase, pretty dramatic increase in the global natural disasters that we see. So these changes that from the year 1970 to 2024 look at droughts, floods, extreme weather, temperature, wildfires, glacier changes, rise in water levels, and anywhere from floods and also to droughts. So if you look at these, why these are really real changes, but in part they're also due to, I think, changes in reporting. So we need to understand that. But these are hugely impactful to health. We can remember the Australian fires of 2019 and 2020, 6 months event across that continent. And over a billion animals were either killed or dislocated. To just show you how climate and these changes and impact and intensity of these patterns have changed and now become part of the issues of One Health moving forward. Next. Next, please. As part of the climate change and a part of movements of people and animals, we now see an increase in vector-borne diseases, and climate complex epidemiology has changed dramatically. And from the year 2004 to 2016, there's a threefold increase in vector-borne diseases, a twofold increase just in tick-borne diseases. And during that time, the identification of 9 new diseases reported for the first time. CDC estimates that there are 500,000 new cases of Lyme disease a year. And I live in Ohio, and right now there are counties in Ohio where the threat is the same as we find in Lyme, Connecticut, and New England. So climate change can impact disease distribution and continues to do so. And then we also worry about invasive species and what they might do with different climates and different movements. The Asian longhorn tick is one example of that came in the United States in 2017. It's moving across the US pretty quickly. It's responsible for anaplasmosis and babesiosis, Ehrlichia, and perhaps even Lyme disease in humans. Next. I have a colleague that Dr. Larry Brilliant, which is a great name for an epidemiologist, by the way. And it's his quote that said, "Outbreaks are inevitable, but pandemics are optional." So if you think about that, what will transpire? What do we need to kind of break this transition from an epidemic to a pandemic? And I think One Health plays an important role in blunting that transition and moving forward. So we know One Health is kind of characterized with prevention strategies in particular, not waiting until after the event has happened. It's based on early detection and response, which is really important to making sure that outbreaks don't become pandemics. It focuses on domains of animals and environment, so much closer to where these epidemics and outbreaks are originating, which is important. And it emphasizes resilience. And so those characteristics of One Health are important strategies then and philosophy to break this transition of moving from inevitable outbreaks in terms of potential pandemics. Next. So these are really predictable trends. So from Wellcome Trust study from 2011 to 2017, they actually traced 1,307 epidemic events in humans, 80% zoonotic. And there were 186 global epidemics average per year just in people. So we know prevention, early detection, and response then are key to this preparedness. And because of these events and their emergence, the importance of One Health continues to be acknowledged. And we remember COVID-19, which is still estimated to cost us globally about $14 trillion. And the last pandemics have occurred at 15-year intervals. So they're no longer 100-year events, occurring more rapidly with more intensity and certainly more consequences. Next. So today there are new headwinds and challenges, especially as we move from kind of our movement in One Health in 2006 and look at 2026, 20 years later. So what are those new headwinds? What challenges come with them, as we move forward? So the warning lights continue to blink red, right? These factors that we've talked about and that we talked about in 2003. They're accelerating, they're intensified, and they're magnified. Outbreaks will be more frequent, certainly more consequential. Wicked problems, which I'll address in just a minute, are increasing with fewer solutions. And I believe we are still poorly prepared for the next global pandemic, which is sure to come, probably sooner than later, and likely to be zoonotic. And the failure to mitigate could prevent the achievement of key UN development factors, whether there's poverty, hunger, safe water, food insecurity, health of children and women. So these factors may be at risk if we don't do something more in the One Health area. New issues in environment and ecosystems. And we think about One Health really focusing on prevention, which it does, right? We look at where we are in the United States today. In the United States, we spend $5.3 trillion in healthcare. That means about $15,000 per person in the United States. And of that, only 3% of those healthcare dollars go on prevention. So kind of what's wrong with this figure? Why is it that One Health hasn't gained more acceptance moving forward? Next. We talk about wicked problems, right? These are unique problems that are born out of complexity in society. There are no yes or no answers to them. They're complex. They can cause other problems, often called syndemics. They're especially characterized by one thing, and that is old solutions don't work as well, and new ones are still forming. So because wicked problems are part of the society that generates them, any resolution calls for the involvement and changes in that society. So I think it's probably One Health's greatest challenge today, this multi-stakeholder collaboration that's needed in what we would term a bipolar world that seems they can't agree on anything, is one of our difficult challenges to achieve really big things. So we need to build on dynamic relationships and multiple perspectives, which One Health does. And I remember a quote from the Baltimore Sun editor many years ago that said, "For every complex problem, there's always a simple answer. Unfortunately, that's almost always wrong." So these wicked problems have multidisciplinary, holistic kinds of solutions that are necessary, which are the centerpiece of One Health. Next. So if we looked at One Health strategies today and look at this approach as kind of a business entity, that we have a product, which is this approach and different strategies, what would a market analysis show us? And what are existing barriers? So we need to know these in order to move forward. One, based on public explanation, it's really kind of a vague thing for them to understand. It's not easy. It's dynamic. It's interconnected. It's been difficult to translate the theory in One Health to practice. And we'll talk a little bit about the need then for our ability to be able to do that in implementation. That reactions to threats have been not proactive, but been preventive. And when we have a pandemic or a threat, then we all get serious about it rather than trying to balance and trying to prevent it. Our fragmentation of organizations and disciplines really work against us. In veterinary medicine, there's 40 distinct specialties today. There's 22 specialty organizations that are recognized by AVMA. And there's 16,500 diplomats that specialize in different areas. And what we need in One Health is the ability to have a national narrative, a national clarity, a national cohesiveness in veterinary medicine to help prepare us forward in a time where fragmentation becomes difficult to do that. There's a lack of emphasis in kind of policy development and long-term funding. This low public awareness and buy-in, we need to do more in our communication strategies. We're doing it at a time when the country becomes kind of angry, if you will, bipolar, not agreeing on much of anything. We need to reconcile this interconnectedness of science, society, and politics, a polarization of science today. So as we're trying to make this change and transforming into One Health, we're running up into a difficult time to do that, to restore our public trust. addressing our talent pool, where we have a lot of people now involved in One Health and being trained. I would say what we really need then is still minimal from what's actually needed globally. We need to drive a compelling message. And sometimes in things like antimicrobial resistance, there's no what we call burning platform. The idea where you were in the Gulf and you had oil platforms on fire and you had to make a decision and you jump. These are slow moving epidemics where decision making and actions then are not as critical in people's minds. Next. Next, please. So we've learned a lot of lessons in past outbreaks and pandemics. What we need to do is to apply those lessons moving forward. One of the things we've learned, and I've read about after study reports from at least 10 different epidemics and pandemics, is there's always this idea of an external beginner syndrome. That when a pandemic hits or a new epidemic, we always start anew. A lot of times because of new leaders, and we always start from square one rather than starting on base what we've learned in the past. This human exceptionalism, the idea that came out of Barbara Natterson Horowitz's book Ubiquity, the idea that human diseases and humans are very unique and different from other animals is absolutely wrong-minded, right? It's about comparative medicine. It's about learning from other species. Predictable surprises. We're going to have the next pandemic, the next epidemic, sooner than later, and it should not come to a surprise to us, right? It's a prediction and a trend that'll happen. The communication of risk is very difficult, especially for human consumers. Societal problems that was involved society for resolution. We found this undertaking to be difficult. You need to be, and I need to be, reskilled for the 21st century. We're going to talk a little bit about reskilling. The silo thinking and acting. Today, many organizations are organized vertically, hierarchical, yet our problems are horizontal. So we have the wrong, if you will, organization and the wrong kind of leadership models. We need to be multi and transdisciplinary. We need more political support that needs to be sustained. We need to have more evidence of added value of our actions in One Health. The benefit of adopting One Health approaches. More measures of success, changing the national narrative so it's holistic, integrated perspective, not about individual problems or individual diseases, broad collaboration, and working outside and beyond just biomedicine to other specialties. Next. So next, please. So we're going to look at kind of the emphasis of new insights. So I'm going to propose like 6 new ideas that come probably from outside of One Health and biomedicine that we could adopt and that I think would help us move One Health forward in a transformation. One is the education and training. We're learning new competencies are necessary to prepare the One Health workforce moving forward. The idea of dissemination and implementation of sciences being adopted by One Health to close what we know is the knowing doing gap. The ability to scale and enlarge the One Health footprint with new business models and to recheck and look at our value proposition. Rethinking from right to left, the idea of key vision and compelling recruitment of partners comes in why we're doing this. How to get big things done. Moving One Health as a transformation and overcoming barriers to get that done. And then adopting effective leadership models as we move forward. Next. So let's take a look at these 6 just briefly as we move ahead. First are these new competencies. And it was John Cotter who wrote a book called New Rules, who said, if we have anything to worry about, it's less about opportunities available to us and our ability to acquire the skills and knowledge to take advantage of them. And that's never more true than it is today. And we have opportunities everywhere, but we need to have our skill set and our knowledge available to take advantage of them. And Admiral Thad Allen, who ended up actually helping resolve the Deepwater Horizon crisis, when asked about what leadership is, said the definition of leadership is where and when competencies meet opportunities. So especially for younger members that might be tuned in today, remember that definition where competencies meet opportunities. Opportunities you will have, no question, but do you have the competencies and the experiences as we move forward? Oftentimes, One Health strategies don't get adopted or implemented, not because we don't have the ideas and strategies, but we unfortunately don't have the competencies and the workforce to get them done. Next. So I won't go through these, but these are kind of the critical competencies that come out of CDC, from academia, from other groups that, and we think of competencies as the combination of skills, abilities, and knowledge. But I would say that leadership is the heart of this. Communication, working across boundaries, systems thinking, the collaboration, right? Being diplomatic, dexterity, building teams, relationship building, critical thinking, etc. So take a look at these and take a look at what might be 20 years ago when our new emphasis of One Health came forward, and think of how many of these have changed during that time. Next. One Health is also, I think, part of what we know now today as a convergent science. And we're recognizing One Health as kind of an intellectual cross-pollination, creating a new culture, a new ecosystem incentives to bring relevant sectors together, establishing new frameworks that integrate knowledge from many disciplines. So One Health isn't just about meeting together, and we do that a lot and think it's a One Health meeting, but rather it's promoting a true exchange of mindsets, leading to fundamental different approaches to understand and respond to contemporary problems and health challenges, right? So it's One Health, merging disciplines, professions, and addressing complex problems. For some of you might be interested in that this came out of the convergent science, came out of a white paper from MIT that talked about 3 scientific transformations recently. The first was molecular epidemiology and biology. The second was genomics. And they believe the third is really convergent science, team science, collectively solving and working on the problems today. Right, the centerpiece of One Health. Next. So the discipline of getting things done, implementation. The best decisions are made by science, but the best results are made by effective implementation. And I would say this is one thing that I learned a lot about and certainly wasn't very good about, and I'm trying to get better. But it's one thing I think in One Health that we really need to engage. Next. So recently, NIH was putting forward a lot of new programs, and they are not spending any money on any new programs in terms of kind of health research that don't have dissemination and implementation scientists as part of that. So science of implementation, scientific discipline of getting things done. And we worry about the amount of time it takes from translating evidence-based finding to practice. And how we have to use One Health to kind of push that forward and implementing One Health strategies. There's a book by Bossity that's called Execution, where he said the greatest unaddressed obstacle to business that's success today is the lack of execution and implementation, finding that gap between knowing and doing. Dissemination is about communication, crafting an effective scientific narrative to a targeted distribution. How do we support the uptake of information into complex community settings? And are we doing that well? So dissemination and implementation of research is real. It's essential for a program to move forward in scalability and sustainability. So societal decisions are not based just on science. They're based on context, on trust, and good communication. So we need strategists and experts in dissemination and implementation as part of One Health teams. Next. So again, as we look forward and think about One Health as a business, right? So this is a business endeavor to put your lenses on and look at that, right? So the common finding often found in businesses as they expand, as they reach new critical points, when they become larger, a little more disconnected, Their products are being spread forward and looked at more critically. And so we see these S-shaped curves that move forward, right? So if you look at the bottom one, this is the typical innovation curve that businesses go through, right? You start with the birth of a business, it goes through growth, it scales up very quickly when it's successful, it reaches a mature phase, and then it will decline unless you move forward and make changes and adapt strategies. So you need to understand when to move forward from one curve to the next. And I think that's where we are now in One Health, where we have to have new skilled talent. We have to adapt new systems and processes, more engaged in relationships with stakeholders and getting their perspectives, getting more resources, the idea of communicating to diverse populations in diverse ways, how to manage change, building brand loyalty in a market. If you think about One Health, that's what we need to think about. Testing their value distribution, and then when to move from this mature phase of One Health into the next curve. Next. So, as in a business, we need to think of the value proposition of One Health. So communicating the unique value and benefits of One Health to our constituents and why they should choose One Health over existing options, right? So evidence-based information, why One Health is better and an improvement over the status quo. That's key to success. It's key to our messaging. And we need to constantly test our One Health strategies and approach to make sure they're acceptable and find out if we need to adjust them. Next. So the other one that I think is really important, and people listening to this webinar might be interested in a TED Talk by Simon Sinek, and in his book called Starting with Why. And he talks about bright leaders never start with what needs to be done. They start with why we need to do things. And the why then is the inspiration for action. So if I would ask everybody on this webinar what they do, they probably could tell me pretty easily about how they do things, maybe what they do, but what we want to know is why you do them. So starting with solutions is the wrong place to begin. We have to begin by defining the desired outcomes and benefits, right? Our driving persons and belief. Why do we want One Health approach, right? And we start with why. Obviously, we have to know the how and what, but we start with why to move forward. And I think we really miss that often when we are messaging One Health. Next. So answering the questions of why creates a sense of purpose and our belonging, right? So effective leaders start with why. It's the real inspiration. It's what links emotions and help us to convince other people, the heart and mind, to accept and commit. It's part of the strategy of what leaders do. Next. So the fifth one is consider One Health in the midst of a new transformation. So transformation is a profound change or shift in perspectives and behaviors or mindsets. Transformations often involve growth, learning, adapting to new circumstances, and insights. In my mind, the veterinary profession has undergone 4 major transformations. It's now undergoing a 5th, which is One Health. So past transformations had very strong societal and economic dimensions. And the profession of veterinary medicine has changed because of that. Next. So let's just look really quickly at past transformations of veterinary medicine. I would go back maybe to the Middle Ages to the 19th century, the era and value and reliance of horses. So countries and armies with great horses won battles, right? And there was a new appreciation of the value of horses and treating horses and making sure that they were optimized. It was kind of the beginning, that value of diseases and understanding them, and the value of animals. This was actually before veterinary education, maybe from 1750 to 1870, and due into era of rinderpest epidemics that caused millions of animals to die, especially cattle. It created famine across Europe in particular. And then people recognized the need for animal health expertise, that they were too important causing human health and problems and not just animal health. And that was when the first College of Veterinary Medicine was started in about 1762 in France. And then a third transformation, maybe 1870 to 1970. Was a new era of new economic value of food animals, increasing human populations, the new emphasis in research in animal health and veterinary medicine, and trade, a new new government animal health services statewide and federal, and the start of a number of new veterinary schools. The fourth transformation probably was started in today. It continues today. It's an era of expanding companion animal medicine. All right. It's corporations being more involved, new specialty colleges, and the recognition of the human animal bond. A key part of One Health, by the way. But that was a new era of people moving into companion animal medicine. And then I think the fifth transformation is where we are today. Starting in around 2003, this era of microbial threats, the appreciation of these complex drivers and convergence model, evolving environment and ecological systems, and fulfilling environmental oath that we see today. Next. So this, I believe, we're in the midst of the fifth transformation of veterinary medicine. We'll call it the One Health transformation. We're certainly just getting started, right? It's this transformation of convergence, the idea the value of our professions has to adopt interdisciplinary work to achieve new horizons of opportunities in our highly interconnected world, and the need to change our relevance and our impact. So we wake up every morning now concerned about new emerging infections, even non-infectious diseases impacted One Health, antimicrobial resistance, more work in comparative medicine and biomedical research, food safety and security issues, conservation, medicine, loss of biodiversity, mitigating the next pandemic, and indeed the health and wellness of all species. So we're in the midst of this. Next. And we have a ways to go. Next. So one of the things I wanted to bring to your attention, this is the model veterinary oath that was proposed by the World Veterinary Association in 2019. And it says, as a member of the global veterinary profession, I solemnly swear to use my scientific knowledge, skill, and training to prevent, diagnose, treat, manage pain and diseases in all species, right? To communicate and help prevent the impact of diseases in humans, zoonoses, that originate directly from animals or via vector transmission, the use of animal products and environmental contaminants of animal origin, to advocate for the sustainable use of terrestrial, aerial, aquatic animals in their diverse ecosystems through the stewardship and reducing environmental impact, and to contribute to animal, human, environmental health by continuing developing my competencies as a health professional acting with integrity, promoting an animal welfare. This to me is, is the One Health model that we're moving forward in this transformation. So if you were going to build a way of veterinarians to think about who we are and what we do, I think this is it. And this was proposed by the World Veterinary Association, and wanting all countries to adopt this or change their oath to reflect this. So this is the essence of One Health. Next. So the final one is this kind of new definition of leadership, right? It's contemporary leadership is a shift from looking at heroes to leaders as facilitators. Shifts from individual authoritative leader to this constellation of complementary leaders or leadership and not just leaders, right? The idea that a few people in an organization should try to lead it is no longer relevant or acceptable. We have systems leaders, meta leaders. Titles and positions are not critical. It's the relationships and influence. So leaders and followers can be interchangeable. Next. So one of the things that you can actually be involved in if you aren't is this idea of becoming a meta leader. So meta leadership really came about because of what we've seen in the complexity of our past kinds of problems. And it involves, first of all, the person, your skill set, your knowledge, the ability to lead up, the ability to lead down or into your organization, but especially the ability to lead across or leading across organizations where you don't have authority, to lead beyond your own profession and into other communities. So that's the One Health leadership. I think it has special skills, and it needs situation analysis and awareness. You actually can sign up and be involved in the dimensions of meta leadership. It's actually involved in a Harvard group that's leading it. Next. So the last part of new leadership is this idea of, well, we believe in systems thinking, but systems thinking is not enough unless we have systems leaders to help operationalize that. From the perfect microbial storm to the perfect storm of chaotic forces and how we actually navigate that. Our contemporary challenges in technology and geopolitics, constant disruptions, the ability to build relationships just holistically, to have real skill in the sphere of influencing others internally and externally, understanding and managing context. Next. So our final thoughts as we kind of close out. Next. So the one thing that I wanted to kind of close on is this idea of the structure of scientific revolutions. It's a book and concept by Thomas Kuhn a few decades ago. And he talked about paradigm shifts, the structure of scientific revolutions. He says science doesn't progress linearly with accumulation of knowledge, but rather changes and revolutions or paradigm shifts, i.e. transformations. At points in time, scientific inquiry and theory are abruptly transformed. It's manifested when old solutions of the past don't solve today's problems effectively, and new solutions are just emerging. This abrupt shift may take a generation. And what have we talked about? It's been a generation from 2006 until that AVMA national meeting. One generation is 20 years to where we are today. And that idea of what a transformation is, and this acceptance and utility of One Health may not necessarily be linear, but revolutionary, and with a transformation, it will kind of change where we're going in the future. Next. So lastly, so we've talked about how to continue and champion progress, right? And the one thing I want to stress about this seminar or webinar, this is not a criticism, right? It's not a criticism of our profession. We have wonderful people doing great things. It's certainly not a criticism of private practitioners, but I think they need to acknowledge themselves as One Health practitioners as well, whether it's human-animal bond, food security, antimicrobial resistance, to be part of a national coalition, right? So we need to build new generation of challenges, to build this bigger tent by making more people in. Transformations are hard but necessary. We need to envision One Health through these new lenses, these 6 things I talked about, of looking at kind of One Health as a business enterprise and how they have moved forward. A compelling message and stories that we need to upskill. Right now, some groups believe that there's a loss of skills about 35%, right? So over a 5-year period of time, right, we may lose 35% of our skill set that's necessary to be successful. So think of that. So think of those competencies in One Health that we know today that we didn't realize 20 years ago, and how those have changed. We need a new professional commitment through this change in strategy. And the one thing I'll mention to you is one of the reasons that I'm doing this is that we've written a viewpoint in the Journal of American Veterinary Medical Association calling Will Veterinary Medicine Transform Itself to meet today's critical One Health challenges and remain relevant to societal needs and true to its oath. So that's online today, and it'll be probably coming out in one of the next editions of JAVMA. And it's the idea of understanding these four transformations and pushing the leadership of One Health forward in the veterinary profession, in the executive directors of AVMA, to go ahead and restart One Health. We call it a 2.0 One Health strategy or transformation of the profession. And leadership is at the heart of these movements. We need to think about a unifying national narrative. Are we keeping our promise? Look at the oath that you and I took. And are we actually doing the things that the oath suggested? Understanding and involving the changing context today. To think local and act local. We're doing this in Ohio. Ohio just got $15 million from its state legislature based on One Health in Ohio, getting new practitioners to work in areas of food animal medicine, but also moving toward One Health. So it's a galvanizing moment for veterinary medicine. And we can't transform others unless we first transform ourselves. Last slide. So the last slide for me is this one. It's the idea of human agency. So it's your agency and it's mine. And an agency is your capacity to make choices, to act, and exert influence over yourself and the world around you. Confidence to tackle obstacles in the face of uncertainty, to achieve a healthier and more sustainable world. So no matter what happens around us and the challenges and the discord, we're in control of our own thinking and own actions. That is your human agency. That is the building block to move One Health forward. And I remain what I would call an urgent optimist, grounded in inspiration and in action, motivated to make a difference and a positive impact on the future, to reimagine what is possible and to make it happen. And I think that's a real challenge for all of us and all of you listening today as members of the American College of Veterinary Preventive Medicine, because I think you are instrumental, if you will, in moving forward in this One Health 2.0. So I express my thanks to the college for allowing me to present this webinar. Sincere thanks to all of you, for individual members of the American College of Veterinary Preventive Medicine, for your very productive work and your commitment to One Health. You're going to be critical as the important members guiding the coalition needed to lead efforts toward creating a One Health 2.0 transformation. I certainly appreciate your time and attention, and I will stop with that and see if there are any questions moving forward.
We do have some questions, and I'll go ahead and pose those to Dr. King. The first question starts off with a thank you for sharing your insights on One Health. In your opinion, how do you think the use of artificial intelligence may change or enhance the practice of One Health?
So it's a great question, and I've thought about that, but it's certainly one of our generational changes, right? I think it will give an opportunity probably for the public to be more engaged. So we've always been worried and gain more of an understanding in terms of what health might be and its benefit. And to be able to take complex kinds of ideas and to kind of simplify them, if you will, for more understanding. So I think that's going to be critically important. I think it's going to be critically important also to make sure that, that our AI kinds of communications are still accurate, that we don't get involved in just depending on AI for everything. I think one of the most important competencies in the 21st century is still the idea of forming teams and building relationships. And I don't think you can do that with AI online. So I think the building of those relationships still become personal. They still become the idea of connecting with people, using AI and the benefits of it, but not losing this connection and our ability to communicate kind of human feelings, human needs, and emotions.
Okay. An attendee asks, if you have any thoughts on how we can overcome statutes, regulations, and policies to achieve the paradigm shifts in a One Health model.
Right, and I think that's engaging the political side. So we talked about, the convergence of kind of science, policy, and politics. And so I think a lot of this becomes local issues. It's becoming progressively more difficult to do this in a national kind of narrative and strategy today. I think things need to settle down a little bit. This kind of anti-science sentiment is not very helpful. But I found out this might be the time to really spend our attention and to build relationships locally. So we've done it in Ohio. We were able to sit down with politicians, with policymakers, with people who fund and do budgets, and be able to sell the idea of One Health and why it's important to their constituents in the state of Ohio and how to make health, how to improve health in the state and why they could be part of it. Fortunately, Ohio State has, College of Veterinary Medicine has a good reputation, and they understand that an investment in this strategy is an investment in their individual constituents in their state. They get that. And that's why the college was able to get 15 million new dollars and kind of based on this One Health strategy and One Health in Ohio. So why it may be difficult sledding to do these things federally and nationally, this is the time to go and strengthen those relationships critically. We can do that, the people listening here. Politicians, decision makers, policymakers still want to hear from you at a local level in particular. And those relationships mean everything. It's the time to build those up. It's the time then to construct new kinds of policies and changes where we're not facing, new barriers, where these policymakers can actually help us move forward. And then to do that also with the help of public health, with community health, and strategies from other organizations who are part of One Health to be able to also talk about that same kind of conversation. In Ohio State University, we have 7 health sciences on one campus. And the ability then to exchange ideas, the ability to put learning together, and the ability to go forward, whether it's a global health or local health, as a strategy of these health science biomedical communities becomes very strong, and it's a way of getting it done.
Okay. Cindy asks if there's ever been any consideration regarding adding economic health as a fourth aspect of One Health.
So I kind of learned that. That's a great question. I learned that lesson a long time ago. I remember going into other countries that we were working on One Health or working on outbreaks and preparing with them. And we always went to, commissioners and secretaries of agriculture and veterinary medicine. And the people we really needed to turn to were the ministers of economics and finance. They're the ones that made the final decision. They're the ones that kind of held the purse strings. And for those of you interested, you might look at what kind of world global health is doing in terms of business. So I think it's really interesting then if you were going to do a speech or want to convince in a compelling way a finance minister, that's really what you need. And it goes back to this business concept of why One Health strategy is more important economically and strategically in the health of animals, people, and environment, and make that case. And then why finance ministers should help support this. So I think it's a really good idea, and don't leave them out. Don't leave them out of our conversations.
Okay, we'll do a couple more. I'm going to integrate this one into a question that I've been thinking of, and as you think of veterinary education today, I guess I look at it as we're kind of a victim of our own success. The advancements in veterinary medicine, and I'm sure human medicine, are advancing so rapidly. How do we educate our young veterinarians or soon to be veterinarians with all of that advancement going on? How do we fit in the One Health concept?
We need to start from day one when they get in, or probably before that, but at least day one they're in veterinary school, and say, in 4 years you're going to read the oath, but here it is. You need to start thinking about this now. And during your 4 years of your veterinary training and education, we're going to introduce you to the full dimensions of One Health. That includes private practice, but it includes all these other dimensions that you can be involved in. They're exciting. They help you make decisions about your future. and they're very inspirational in terms of your actions and what can be done. I find that young people today are really taken with what they can do to make, really productive changes. They're really motivated. They just need to have that education, if you will, of why this is important and make sure that they're introduced to research, that introduced to public health, introduced to food animal medicine, which many of them are neglecting. And I think they have to do that from day one. I really like the idea of these veterinary schools in North America getting together now and talking about the best ways to teach new competencies in One Health. So not only our new graduates understand these, but they will be prepared and competent to take advantage. So remember that we talked about, you know, making sure that opportunities meet competencies. The opportunities are there. We just have to make sure that our young people are competent in taking advantage of them.
And is there any talk on cross-pollination of veterinarians and medical school or veterinary schools and medical school curriculums?
Yeah, the one thing that started in antimicrobial resistance now is teaching antimicrobial resistance across biomedicine. And there's groups today in professional education, right? That are now there's 190 different organizations under this IPE organization that talk about how you educate across medical education. How do you build teams? How do you connect? How do you improve or don't make mistakes, medical errors? And now they're involving veterinary medicine as part of this community in this interprofessional education. It's really exciting to think about 190 organizations around the country now, often involved with veterinary medicine, medical schools, and public health, that are now starting to teach interprofessional education. And the idea of multiple dimensions and learning what these other professions have to add before you can solve a problem. And that is really, I think, an interesting way to go. And Eric and our folks in ACVPM, this is also one thing you might think about in terms of the future is bringing IPE to the American College of Veterinary Preventive Medicine as a strategy.
Okay. And the final comment, and then there's a question kind of at the end, is regarding the oath. You showed the World Veterinary Association's version, and the comment is our AVMA version is intentionally written to prioritize our efforts towards society and humans. The World Veterinary version or Association version, however, does not reflect that priority quite as well. Does this matter?
Yeah, it matters. I mean, I think that there's give and take, and my idea wasn't to take the strategies of the World Veterinary Association and make it ours. We have an oath. Our oath has changed a little bit, but I don't think it has probably emphasized enough kind of the dimensions of One Health. But I'm also concerned that kind of veterinary students at the end of the fourth year here in a few weeks when they graduate are going to utter the oath. But are they really going to pay attention to what they've promised over their next 30, 40 years of their lifetime? So I have no qualms about our oath. I do think it can be reemphasized and probably developed to better reflect the dimensions of One Health. I'm glad we have it, and I pledged to it many years ago, and I'm trying to keep up my end of it.
Outstanding. I had one attendee ask to show the One Health timeline, so I'm going to run back to that slide, and then I'm going to close out today's session with, first of all, a thank you, Dr. King. This has been a very inspiring and insightful presentation on One Health. We can't say enough how much we appreciate your doing this for the ACVPM and all the attendees. I'm sure you're seeing the hearts and the clapping hands and everything coming up on Zoom. So I believe the attendees feel the same way. I want to put a plug in for our webinar program. We're always looking for volunteers such as Dr. King to present topics. So if you're interested in presenting yourself, or if you have a good idea or someone that you think would do a great job, please contact us. The ACVPM website has a tab for continuing education. There's a way to nominate speakers there. You can also email myself at admin@acvpm.org, and I will get those nominations into the hands of our continuing education committee, who will consider. Um, if you have an idea, please forward it to us. Our next webinar, we have not sent that invitation out. That will come out in the next day or two. And with that, once again, Dr. King, I definitely appreciate your commitment to One Health, commitment to the profession, and for your commitment to the ACVPM. And anything I can do for you, let me know.
Thanks, Eric. My pleasure.
All right. So we'll close out today, and thank you very much, everybody. Have a great evening wherever you may be in this world.